Welcome everybody. Can I introduce Michelle Toy from the New South Wales Users and AIDS Association to acknowledge country.
Warami everyone, that means hello in Darug. My name is Michelle Toy and I am a proud Darug woman. I've been asked to do an acknowledgement of country today for today's symposium. For those meeting in person, I would like to acknowledge that we are meeting on the unceded land of the Bidjigal people. I would like to pay my respects to their elders, both past and present, and extend that respect to any First Nations people here today. I would also like to acknowledge the traditional custodians of all the lands on which people are calling in online from today, and pay my respects to their elders, both past and present. Part of today's symposium is focused on exploring how we make alcohol and other drug policy better. A conversation I am sure is what guides our work every day. When thinking about how we can make drug policy better, it is critical to recognise that we are talking about a colonial legal system that has been designed to and continues to cause disproportionate harm to Aboriginal and Torres Strait Islander people, families and communities today. And this also causes harm to other marginalised communities. Better policy should contribute to dismantling that. Better policy means investing in, listening to and being led by First Nations people, experiences and knowledges. This isn't new or profound, but it is something that I urge everyone to continue to work towards and have front of mind as we reflect today and continue to work towards systemic change. First Nation sovereignty was never ceded, and this always was and always will be Aboriginal land. Thank you.
Hello everybody and welcome to the 2024 Drug Policy Modelling Program Symposium. For those who don't know me, my name's Professor Verity Firth. I'm the Vice President Societal Impact, Equity and Engagement here at UNSW, and I'd really like to extend a warm welcome to you all for being at this extremely important symposium. I'd also like to acknowledge country, obviously, to recognise that we're on the land of the Bidjigal people, to pay respect to elders past and present, and to thank Michelle for her acknowledgement. Michelle is a Darug woman with a professional background in law and social policy. She's a human rights advocate and works as a policy and advocacy lead for the New South Wales Users and AIDS Association. She has a personal interest in evidence-based drug reform that prioritises community-driven harm reduction that centres the lived experience of people who use drugs. So I wanted to pay a particular thank you to Michelle because that's wonderful to have you and your expertise here with us today. We've got a lot of amazing speakers actually, so I hope you enjoy the program. They'll be sharing critical research around drug-related policy, law reforms, treatments and approaches. This is a critical area, and I don't think I need to tell this room that we need consistent, human-centric and holistic approaches to spanning prevention, harm reduction, intervention and treatment, all the way to rehabilitation and recovery. With so many touch points, it's really wonderful to see you all here today, so many of you from different organisations, and of course to all of those joining us online, everyone united in addressing this issue, exchanging knowledge and driving tangible positive change. The first research that we'll be unpacking this morning, and the catalyst for the event, is the 2021-2022 Australian Drug Budget. Hopefully you've all had a chance to have a look. It's being shared for the first time here today, and it's a UNSW report providing a new analysis of the government's spend in response to illicit drugs and whether Australia is on the right path to reducing drug-related harm. It was interesting because just before we started, I was having a little conversation off to the side with a few people over there, and we were talking about the New South Wales government's commitment to host a drug summit. We've obviously got to keep the pressure on to make sure that they actually do that. It is an election commitment. And it was causing me to think about the previous drug summit. Now, that was in 1999. I wasn't actually in Parliament then. I used to be in Parliament, but I wasn't in Parliament as long ago as that. But I do remember reading about it and being so impressed about it as a case study for driving reform. It was a process that allowed evidence-based and expertise to enter public policy making in a way that it hadn't before, especially around an issue as emotive and tricky as drug and alcohol dependency. And it really allowed a moment in time where, as I think Emma Maiden just said to me offline, the middle of the parliamentary opinion was able to come together and do something really quite, for at that time, considered radical. It also helped garner community support, because I think there's not a single family, I definitely don't have a single interaction with virtually anyone whose family or friends haven't been touched at some point by drug and alcohol. So this idea that this is an issue that people are very conservative about isn't necessarily true. People understand what is needed and the nuance and myriad of approaches that are needed to address this issue. So I'm really pleased that you're all here today to help us do that. And it's my pleasure to introduce the report's lead author and drug policy specialist at the UNSW Social Policy Research Centre, Professor Alison Ritter AO. Alison is a leading research specialist whose interests and insight span drug laws, drug treatment models and methods of participation in drug policy, and research focused on policy process. She is Director of the Drug Policy Modelling Program here at UNSW. She has a strong track record of research translation with a history of practical application and influence towards drugs policy in Australia. So please join me by welcoming Alison.
Thank you very much. Thank you very much, Verity. Thank you very much, Michelle, for acknowledgement of country. Always was, always will be Aboriginal land. Welcome. It's fantastic to be here today, and my role is to summarise the Australian drug budget work that we've been undertaking, and then my colleague will lead us in a panel. It looks really easy and simple with a nice bunch of tables, but boy, there is a huge amount of work that goes on to develop a drug budget analysis. And can I particularly acknowledge the team, Meg Greeley, Paul Kaleta and Michaela Kowalski, huge amount of work that the team has done to put this together, which we're delighted to launch today. Spending on illicit drug countermeasures. The first question is, which drugs are in scope? The drugs that are covered are only the illicit drugs. That is, let me just fix this screen. Cannabis, heroin, cocaine, methamphetamine, heroin. So it doesn't include alcohol and tobacco. It does include the misuse of medications like pharmaceutical opioids to the extent to which they're included in the treatment and the harm reduction estimates. In terms of which costs, there are two different ways you can split government spending. The first way is to think about goal-directed activities that are aimed at reducing the drug problem. These could be termed countermeasures, and in health economics it's referred to as proactive spending. So these are decisions made, choices made about what to spend to reduce the drug problem. The second type of spending, which is also substantial, is the consequences of drug-related issues across society. Things like the cost of overdoses, the cost of lost productivity, the cost of injuries. These are often referred to as the social costs or the consequences of our drug policies. This drug budget is concerned only with proactive spending. So it's only the spending that governments have chosen to make in terms of their policy choices around countermeasures. And we divide proactive spending into four different types. Spending to prevent the commencement of drug use, which is the prevention spend. Spending to reduce consumption, which is treatment, which also obviously reduces harm. Spending to reduce the harms associated with drug use without changing drug use per se. We classify that as harm reduction. And finally, spending to reduce the availability and accessibility of drugs, which is, of course, law enforcement. And these four domains, prevention, treatment, harm reduction and law enforcement, comprise the four domains of this Australian drug budget. We've included all of the main activities within each of these domains. So school-based drug education, obviously drug treatment, needle syringe programs in harm reduction and policing and border control in law enforcement. But we haven't been able to include everything, and there's a list here of some of the exclusions on the right-hand side. In addition, sometimes it's hard to decide which domain you put a particular activity in. So a lot of drug treatment also reduces harm, and there are needle syringe programs offered in many alcohol and drug treatment services. So there's a kind of a somewhat artificial characterisation sometimes for some of the domains. In terms of the costing approach, we chose 2021-2022 as that was the year that had the most available data. There are two different ways of doing these costing exercises. One is bottom up. That's when you collect each activity and how much it costs and then sum it. And the other is top down. That is when you take an expenditure item and you divide it by some kind of drug related activity. They're apples and oranges. So if you do a health economic analysis bottom up, you'll get one number, and if you do it top down, you'll get a different number. What we wanted to do was to make sure that the domains were comparable. So for the first time, we've done a top-down estimate for treatment, for prevention and for law enforcement. Unfortunately, we couldn't do it for harm reduction. So harm reduction remains a bottom-up estimate in this report. And of course, there are a heap of assumptions, which is why we had to do sensitivity analyses, and the devil is definitely in the detail. So to just give you some examples of this, in school-based drug education, for example, we took the average number of hours of school-based drug education. This was based on New South Wales and Victorian curriculum data, and that's averaged at 7.26 hours, and then divided that as a proportion of available school hours by the school expenditure. So the assumption here is, of course, that the average hours spent is representative and applies across all schools in Australia. That's a big assumption. We test that in the sensitivity analysis. For general prevention, we used West Australian and Victorian data to get a cost per person of spending on general prevention. The cost per person was actually double that, $5.10. We decided that approximately half of that was alcohol, so we took only 50%. Another big assumption that we test in the sensitivity analysis. For drug treatment, as I've said, we needed to estimate the number of people who received drug treatment in 2021-2022. That's incredibly difficult. There's not one database that does that. So part of the assumption is the estimate of how many people received drug treatment, and then of those people as a proportion of all of the healthcare recipients, we applied it to the total Australian health expenditure. The other big assumption, other than the number of people, is of course that health expenditure somehow divides equally between all activities and it all works out in the wash. We test that assumption in the sensitivity analysis. NSPs, we used cost per needle syringe distributed. Take-home naloxone, we needed to use a research study, although there is an appendix about costing for that. Peer-led drug user organisations, we used annual reports. Customs and border control. So there's not a line item in any Australian expenditure estimate for customs and border control. It's now all home affairs. So that was our first problem. Previously there was customs and border control as a dedicated line item. So we needed to sort out the home affairs expenditure reports, and then we needed to decide how much of that activity is directed towards drugs, and there's actually no way of doing that. You can't compare the number of drug seizures as a proportion of all seizures because border control does a whole lot more than just seize drugs, of course. The best available is an estimate from the United States. Clearly that is somewhat problematic. It estimates that in the US they spend 17.43% on customs and border control. So we did use that percentage, but again, we tested that in our sensitivity analysis. One of the big ticket items is routine policing. We needed to know the proportion of drug offences to all offences. So some people will know that the IDDR provides offence statistics for drug-related offending, but they don't provide the total number of offences, irrespective of drugs. So we needed to use the Australian Bureau of Statistics data, which we have for each state and territory, and we applied that to the state policing expenditure. And in terms of courts and legal costs, the big issue is if If a court case lasts a long time, it's much more expensive than if it's a short court case. So we had to weight the proportion of illicit drug offence cases by the length of the case. So we used case length weighting for those. And then finally for corrective services, the proportion of people in prisons. So 12 months later, having worked through all of that data, you can see how there are many, many assumptions that needed to be made. Those notwithstanding the results, Australia spends a significant amount on illicit drug countermeasures. In fact, for this estimate, it's $5.45 billion in 2021-22. And people ask, well, is that a lot of money? It seems like an awful lot of money, but actually it might not be that much. Compared to total government spending, which was $865 billion, it's 0.63% of all government expenditure. It's also not a lot compared to the social cost of illicit drugs. So I've mentioned the social costs of illicit drugs. There are a number of different estimates, but it's somewhere probably between 12.9 billion and 25 or 26 billion. So we're actually only spending 5.4 billion to address a problem that is costing the community probably around $25 billion. And it's also not a lot compared to previous drug budgets. So I must admit, I panicked when I saw 5.4 billion because I know that the two previous estimates were around $1 to $2 billion. So we did this work 20 years ago and the estimate was $1.3 billion. About 10 years ago we did it again, it was $1.7 billion. And this estimate is 5.45, and I thought, shit, have we overshot the mark? Well, as it turns out, we had not overshot at all, because when you look at the percentage of government spending, it's actually almost, well, it was 0.5 the first year and 0.8 the second time, and now it's 0.63. So actually what's happened is governments are spending an enormously more money across everything than they were previously. So that was reassuring in that sense. But it's actually less about the 5.45 billion and much more about the distribution. So what you can see here is that $5.4 billion, 6.7% of that goes to prevention, 27.4% goes to treatment, a very small 1.6% goes to harm reduction, and the lion's share goes to law enforcement at 64%. So most drug policy in Australia is spent on law enforcement. Almost nothing, relatively speaking, is spent on harm reduction. The other thing that we've done is there's a chapter on state territory versus the federal government. I think, you know, when you think about policy, most people want to think about it's all about what the federal government does. As it turns out, most of the spending is at state and territory level. So 76% of the 5.45 billion is spent by states and territories. And within that, 70% of the state territory spending is on policing. So our policy advocacy effort needs to be directed towards states and territories rather than federally. And for those that are interested, the federal split is almost 50-50. So they spent 48% on policing federally and 48% on treatment. So the federal government has a very different distribution from the state and territory governments. So I've talked quite a bit about the sensitivity analysis. How confident can we be in the 5.45 billion? It might be as low as 3.9 billion. That's the low estimate, and that varies all of the assumptions that I showed you earlier systematically within each domain. It might be as high as $6.4 billion if you take a different set of assumptions. But what you can see in the last column is that actually the distribution doesn't change that much. It's somewhere between 6 and 10% for prevention, 21 and 29% for treatment. Harm reduction is between 1.6 and 1.8, no matter how you vary the assumptions. And law enforcement is between 55 and 68%. Over the last 20 years, since 2002-3, has the distribution changed? The answer to that is no, and that's a fairly categorical no. The one thing that has shifted is that the treatment investment has gone up. So in the last 20 years, investment in treatment has increased to comprise 27% of the overall drug budget. Harm reduction has declined, down from 3.9% in 2002 to 1.6% in 2021-22, and law enforcement has remained relatively the same, with prevention also reducing. A few conclusions. Firstly, it's important to remember that activities cost different amounts of money. So policing activity is very expensive, and prevention is a much less expensive activity. So you can do more prevention for less. So you need to keep that in mind when we talk about these percentages. Secondly, what the drug budget indicates is the current funding distributions, and I think it does reflect the spending priorities of governments across Australia. I shouldn't have to tell this audience that spending does not equal effectiveness. The fact that we spend most on law enforcement does not mean that law enforcement is the most effective response to drug-related issues. But I think what the drug budget does do is offer foundational data for future cost-effectiveness studies, where perhaps we can say something about the effectiveness of these different domains. The last thing that the drug budget doesn't do is give you advice about ideal spending proportions. It doesn't tell you what it should be. It only tells you what it is, and far be it for researchers to say anything about what it should be. But we do know what the general population thinks about it. They're asked in the National Drug Strategy Household Survey, how would they spend a hypothetical $100? And what you can see here is that they would spend $36 on prevention, $32 on treatment, and $31 on policing. So that represents, I think, what the general population prefer in terms of a drug budget distribution. As researchers, as I said, we don't comment on what we think it should be, but we do luckily have a panel of experts who are going to be commenting on what they think the distribution should be, and I'm delighted to welcome our panellists. Thank you very much, and I'm going to hand over to Dr. Paul Kalata, who's going to facilitate a panel discussion. Thank you.
Thank you so much, Alison. Can I ask our panel to join us on stage, please? Thanks very much. So just while everyone's getting settled, my name is Paul Kalata. I'm a postdoctoral fellow in the Drug Policy Modelling Program and one of the authors of the Drug Budget Report. I'm very pleased to be able to welcome our panel today. So we're very lucky to have 4 leaders in the AOD field and working in this space to comment on the findings, as Alison mentioned. I will just go down the line, starting on this side. So we have Dr. Robert Sterling, the CEO of the Network of Alcohol and Other Drugs Agencies, who has been working in the field for 20 years. Robert plays a key role in supporting the NGO sector in AOD and public health policy, funding, research, sector and workforce development. He's the Deputy Chair of the Australian Alcohol and Other Drugs Council and Chair of the Advisory Board for NCTA. Next to Robert on stage is Dr. Annie Madden, AO, who is the Executive Director of Harm Reduction Australia and has been working in the areas of illicit drug use and drug user representation for over 20 years, including in Australia with the New South Wales Users and AIDS Association and the Australian Injecting and Illicit Drug Users League, as well as internationally through the International Network of People Who Use Drugs. And he has also been a member of Australian government delegations to the UN General Assembly. Next to Annie is Emma Maiden, who's the General Manager of Advocacy and External Relations for Uniting New South Wales ACT, bringing more than 25 years experience in social justice campaigning. Her work with Uniting includes the Fair Treatment campaign to remove criminal penalties for the possession of drugs for personal use and increasing access and availability of alcohol and drug treatment. Down the line is Dr. Erin Laidlaw, AM, who's the CEO of the Alcohol and Drug Foundation, and is a recognised leader in the health policy and not-for-profit sectors, with over 20 years of experience as a clinician, researcher, advocate and leader. She's also a member of the Australian National Advisory Council on Alcohol and Drugs and Deputy Chair of the Australian Institute of Health and Welfare. If we can welcome our panel, please. So just a bit of quick housekeeping. We're going to hear from each of our panellists for about 3 minutes, commenting on the findings, and then we're going to open up for questions. So please get thinking of some questions you'd like to ask. When it does come time for that, if we can ask you to keep your question or comment short so we can get through as many as we can. We're also going to take questions online, so feel free to pop them in the Q&A chat using the live stream. So without further ado, I'll pass over to, we'll start with Erin on the far side.
Bad luck, Rob. Rob and I were talking about the fact that we may be saying similar things in our commentary on this. But firstly, just a huge thank you to Alison and the team at the Drug Policy Modelling Program for updating such an important piece of work that we use a lot in thinking about how we can influence policy in the illicit drug space. And when Alison approached us about doing this work, I think we were really excited to hear that it was being redone because we expected, perhaps naively, to see some sort of change. Because over the last 10 years, we've seen this real shift starting to happen of the need to have a health-based response to drug use rather than a criminal response. So I have to say I was a little disappointed to see that we didn't see that shift at all. Pleased to see an increase in treatment, but not pleased to see that that shift had come from investment in prevention and harm reduction. The expenditure, looking at the data, one of the things that I found interesting was the comment that you made, Alison, about the fact that the majority of health expenditure in this space comes from the states and territories, as does the majority of expenditure in policing. And when you look at the expenditure on policing, corrective services, community corrections, it's greater than the expenditure on treatment. And it would have been really nice to see some of that shifting into increase access for treatment when we know that demand for treatment is not being met. If I focus in on the prevention funding, it looks like a lot on prevention funding. I'm not sure that I would agree with Alison that prevention is cheaper than law enforcement. I think done well and invested in properly, we can see really good returns on investment. We know that returns on investments for things like the Good Sports program, which many of you are familiar with, is 3 to 1. The Western Australian Mental Health Commission says prevention ROI is 14 to 1. There's a very good ROI when you invest in prevention. And yet, in the prevention funding, 75% of it was on education. And not all of that investment in education was using evidence-based approaches to school-based drug education, which we know exists. And in the report, it points out that those sorts of programs do require additional funding, but worthwhile investment when we know that they return. I was also hoping that we wouldn't have seen what we did see, which was a small decline in the proportion of expenditure on illicit drugs as a percentage of total government spending, because it suggests that harms from drugs are decreasing and that we don't need to invest as much money in addressing the harms. And yet we know that's not true. The overdose death reports are showing that we're still seeing unacceptable numbers of lives lost. We're seeing increases in hospitalisation. We're seeing quite significant harm still in the community, and we do need to invest in them. It was really interesting, we were saying last week, the Law Enforcement Committee, Joint Committee of the Federal Parliament released a report that looked at the law enforcement response to illicit drugs, I think was the purpose of the inquiry. And I just thought I'd finish by noting that we are not the only ones that think that we need to see more investment in health responses to illicit drugs, prevention, harm reduction, treatment. And I'll just take a minute to quote, I'm probably close to or over my 3 minutes. So in the report they say, following consideration of the challenges and opportunities for law enforcement, the committee acknowledged that law enforcement cannot meet the challenge of illicit drugs alone, and that Australia's national drug policy recognises this. They noted the National Drugs Strategy has a guiding principle of harm minimisation supported by the 3 pillars: supply reduction, demand reduction, harm reduction. They found that there were issues in the strategy's implementation, including the way its governance structures support its implementation and how it's been reviewed and evaluated. But their third recommendation, thanks to Alison, has perhaps already been partly done. And it was recommended that the evaluation of the National Drug Strategy include a review by the Australian Government in consultation with state and territory governments of the current resourcing for the 3 pillars of the strategy. Should the differences be substantial, and I think we would agree that they are, consideration should be given to increasing funding for demand and harm reduction measures. Any additional allocation in funding should not come at the expense of funding for law enforcement supply reduction efforts. So I think it's timely that we've got a report that shows that there is substantial difference in the investment in those pillars, and it clearly identifies the need for more action.
Thank you. We'll go down the line to Emma next.
Thanks. Here we go. So I'd also like to thank Alison and the team from the Drug Policy Modelling Program for updating this research. When Alison approached us about wanting to do this next update a decade on from the last ones, we were very, very glad to support it, and I think she may have just also flagged a potential future area for research as well that we'd be very keen to support in terms of the effectiveness of those different streams, because I think that is one area that is kind of missing. So it's just so important that we continue to add to the evidence base, as Alison called it, in terms of our drug laws, but we are adding to a very considerable evidence base that exists there. And I think what a lot of us that work in this space find really difficult is the lack of rationality in the way those that are making decisions about how we deploy our laws and our processes to deal with drug and alcohol issues, don't really respond to that evidence base. But this research is really important, and the cynic in me probably wasn't as surprised as you were, Erin, that things haven't changed over the last decade or since the drug budget was first done. I mean, it confirms, exactly, within those parameters, how much we're spending on law enforcement, that kind of 2/3, 1/3, and is really quite shocking. But I'm not surprised that hasn't changed when you hear the way certain portions of the media talk about these issues, and even the quote that Erin just referred to from the federal parliament about not wanting to reduce any spending on law enforcement, and that desire that people have to really cling to something that we know just doesn't work. And as working at Uniting, and we operate the injecting centre. In fact, we're doing our own small contribution to the evidence base with the drug checking pilot that we're doing at the injecting centre at the moment. We know the impact that harm reduction measures have, and to think that it's only 1.6% of the drug budget is really terrible, that it's reduced over the last 20 years, and it does show what the government thinks is important, and it doesn't value that work and the contribution that it makes to reducing the harms of drugs and alcohol. So we were hoping that when we began talking about this research would be able to be taken to the Drug Summit, which is the promise, as Verity referred to, that the New South Wales government has made to take the issues of drug policy forward. But we need a date for that, and we just don't have a date. That's incredibly disappointing to us in the Fair Treatment campaign. We've got a number of our partners here in the room, a number of members of the Uniting Fair Treatment team are here as well. And we really are trying to keep the pressure on the government to announce that date for a 5-day drug summit, just like the one that happened in 1999. We know that it is a far from perfect mechanism to get change, but it is, the next step that we have to try to get the government to move on what has been quite a stagnant area of policy reform over the last 20 years. So, we'll hopefully I don't know why I still am optimistic, because I remember we were calling for 2.5 years in response to the ICE inquiry. But, you know, we need that date, we need to keep the pressure on, and I'd just like to really invite all of you to be part of keeping that pressure, meet with your MP, engage and counter those kind of negative media stories that we have. Use this research to get the story out there about how we need to do things differently. Thanks.
Thank you.
Oh, you've got yours.
Oh, you got one? So you can keep it. Good morning, everyone. My name's Annie Madden. I'm from Harm Reduction Australia. I'd like to thank Alison and the team for this report. Given what Alison has said, I think there'll be no prizes for guessing what I'm going to talk about today, but I've got a couple of minutes, so here we go. So despite recent data showing that illicit drug use is in fact increasing in Australia, we've seen here in this report that shows that government investment in programs and services to reduce drug-related harm are actually at an all-time low. 5 deaths a day from drug-related overdoses, and we stand here today to see that funding in programs and services that could reduce that harm are in fact declining. So what does that look like? Again, Alison has said this, but I think it bears repeating. It looks like $5.5 billion of proactive government expenditure on illicit drugs in the 21-22 financial year, and less than 1.6%, that's $90 million, was spent on harm reduction. By contrast, almost 65%, or $3.5 billion, was spent on law enforcement. And that's not the worst of it. Most of that funding went to routine street-level policing against drugs, or should I say against people who use drugs, because that's the reality. Street-level policing is what is continuing to violate the human rights of people who use drugs. The truth is, too often policy speak and euphemisms hide the reality of what we're talking about, and that is that the bulk of expenditure on illicit drugs by governments in Australia does go to street-level law enforcement. So we're talking about simple possession and use offences, we're talking about small-scale supply offences and minor drug-related offences. And those drug-related offences in themselves are usually driven by prohibition and the laws. So that's the truth, and this report underlines and underscores that. What's more, this report, which is the first drug budgets report in over a decade, shows without a shadow of a doubt that the consistent claims by the Australian government and the National Drug Strategy that it employs a balanced approach across the 3 pillars of supply reduction, harm reduction and demand reduction is quite simply a lie. This much heralded Australian approach is in fact anything but balanced. I have to say that even though, some people might say, of course, someone like Harm Reduction Australia is always going to be advocating for more funding for harm reduction, we actually ourselves were really shocked and surprised to see that, in fact, what we're looking at in this report is a further reduction in harm reduction funding. I mean, we've gone from an extremely low 2.2% in 2009-10 to unbelievably low 1.6% in 21-22, and it is truly shocking. And one of the reasons this is, I guess there's a few reasons why this is so important. One of them is that, in fact, of all of the domains that we're looking at here in this report, it's harm reduction that actually has the strongest evidence base for its effectiveness, for its impact, for its cost effectiveness, yet it's the one that consistently we're seeing reductions in funding and support. Indeed, As Alison has already highlighted, the National Drug Household Survey, and in fact HRA's own research, which is soon to be released, says that communities want governments to move away from criminalising and punitive responses and towards more humane responses. But I think, even more than all of the sort of support from community for how dollars should be spent, I think one of the things that, this report really underscores is that harm reduction, as I said, is the approach that has the most effective evidence base. And that is important to understand because it's harm reduction initiatives like needle and syringe programs, like take-home naloxone, like drug consumption rooms, pill testing, overdose treatment programs, and I would include something like decrim in harm reduction. The real truth is that saves lives. Harm reduction saves lives, that's a fact. And so why we are looking at decreases in investment in that space is truly shocking. So the question becomes really for us, when will Australian government start listening to the community, which wants to see less investment in criminalising and punitive responses, and when will they heed the evidence that is clearly all around them, and address what can only be described not just as a chronic underinvestment in harm reduction, but a deliberate underinvestment in harm reduction. These are choices, as Alison has already underlined. They need to stop putting the health rights and dignity of too many people at unnecessary risk. We clearly will be using this report to argue and advocate for further funding for harm reduction. We hope all of you will be too, and thanks for your time.
Thanks also to Alison and the media crew and to my colleagues, and yes, we do have some shared messages. I think for many of us, the figures related to the health response are not surprising. In the NGO sector, the majority of the funds actually go to the treatment sector. We have very few members in the organisations that I represent that are specialists in harm reduction or prevention services. That's not to say it's not happening. In fact, a lot of that work is unfunded work that happens from treatment providers as well, providing harm reduction prevention services in communities like community development, community education, and other work. So we would definitely say that it's inadequate and we'll see an increase in professional services, particularly those services delivered by local communities and delivered by populations that they target from. Of course, we think it's positive there's been an increase in treatment of 5.4%, but I don't think many treatment services are going to be walking out of the UK celebrating. When we reflect on the past 12 years since the last figures, we know that there's been some investment that's varied across governments and jurisdictions. But when we think about the New Horizons report that talked about needing to double the treatment places available, I don't think that we're seeing that reflected in the treatment figures in this report. We've also been operating under pretty stressful times over the past 4 years. There's obviously a lot of talk about the rising cost of living, and that equates to a rising cost to deliver services as well. So at the New South Wales level, it's been really positive to see some investment in new services, but they have been new services, and in actual fact, a lot of the existing service infrastructures have been struggling for a really long time, and we haven't seen some support. And we also know that there's been some segments of the treatment sector, such as the residential rehabilitation sector, that haven't seen an investment and any growth or very little growth. Of course, we need a range of treatment services. We need to respond to the needs and respond to the multiple needs of people. But we also need to ensure that services are able to respond to demand. They're able to respond to the increase in wages, the cost to deliver services. We're hearing about the rising cost of insurances, and the treatment sector is struggling. So we would say the growth in health funding, treatment funding, is inadequate. But that's not to say that there hasn't been some great engagement with AOD health policy makers. There's been some great initiatives. The National Indigenous Australians Agency has increased some funding to community-controlled services, which has been really positive. The Department of Health and Aged Care has tried to bring up some of the directly funded treatment services that had a freeze on indexation for a really long time. But what we're seeing really is a band-aid effect of small amounts of money that are being added on, not being added into core agreement, and many of us having to advocate each year to make sure that these contracts are people are able to pay the wages, the increase in wages. And of course, for some segments like the PHN Commission services, they're not seeing any growth at all. So I think what the lack of growth and the piecemeal approach of topping up, I think, has resulted in a real reduction of services. Even so, we're seeing an increase here, and a reduction in services to people, and an insecure workforce, and a workforce that's responding to high levels of complexity. We think that the report is really important for demonstrating transparency and accountability of public funds. Illicit drug policy requires a whole of government response. We heard about the law enforcement report that was handed down. NADA, the AADC, and a lot of the peak bodies support a lot of the recommendations. We're really heartened to see that there's a report about a balance. So it's very fortuitous. And of course, this aligns with the views of the general population that the report talks about, and my colleagues as well. So we have been advocating for a long time that we need national governance. Since COAG disbanded, we have not had proper national governance arrangements to be able to monitor progress against the national drug strategy. We love seeing this type of data. We'd like to see a national report card to look at all aspects of the investment and to see how effective current strategies are. As a peak representing NGOs, we hear a lot from government about the need for transparency and accountability of public funds for NGO services, and we want that to be across the board. As a service delivery sector, we want to demonstrate the positive impact, and we want people to know the positive impact that we're having on communities. So we would like more transparency about public reporting. And I think for us, it's not about scrutinising government. It's about working collaboratively across academia, across policy, across service delivery to look at what's working well, what might not be working well, and how we can improve in other areas. We heard about the upcoming drug summit, and while these figures don't drill down into New South Wales, this report, the law enforcement report, the National Household Drug Survey is really important data. It's informed by evidence, it's informed by the general population and people most impacted. And we'd like to see a commitment from government to have a balanced approach to ensure that investment responds to the health and social needs of communities.
Wonderful. Thank you so much to our panel for that. So we've got two roving mics with Michaela and Liz, but fantastic to hear the kind of range of optimism, disappointment, surprise, the context of political choice and the effects of these expenditure decisions and breakdown on services and on people. So we'll start over there with Jason.
Jason Grebley from the Kirby Institute at UNSW. So first of all, Alison, team, thanks for all your efforts in putting this together, a huge amount of work. And thanks to the panel for their insights around sort of the state of play in the current situation. I think it's pretty clear, that there hasn't been much change, and in some instances, like Annie highlighted, a decline in sort of contribution to funding. What I'm curious to hear from the panel is what needs to be done differently. And I know it's a big question, and I think, not much has changed. And I think maybe to go into more detail, this is a really important output. So do you have any thoughts or recommendations for the stakeholders or the users of this output in terms of how they may be able to sort of use this information to generate greater change and have an increased outcome and impact? I think things haven't changed in 20 years, so we need to be thinking about how can this information be used? Is it about greater investment case, advocacy, but think about the stakeholders in this room, researchers, policymakers, healthcare providers. What would you like to see them do with this output to try and do something differently moving forward? Sorry, I know a very hard question.
It is, but I think it goes back to that working in silos of law enforcement over here, health over here. When are we coming together to monitor the progress of the national drug strategy? We just got an email to say that they're about to start the process of the consultation of the next one. How have we done on this one? I mean, I think that we haven't all come together to understand, to evaluate the different elements of what the investment is, so that we can come together and have those discussions to talk about where we would need to change what we're doing.
Oh, sorry. So as someone just sitting up here and actually hearing Annie in particular talk about, they say a third, and yet we see that that isn't true. And a lot of what we talk about in the Fair Treatment campaign, we talk about needing to double investment in treatment. We do talk about harm reduction. I'm actually wondering where this can really help sharpen our message about what we want to see change, and take that a third. And if we can all kind of begin saying, no, it needs to be a third, because and make that a much sharper kind of ask to government, or I mean, I don't know whether that's the exact right proportion, but it is simple from a messaging point of view. And because even though we have seen the quantum increase, as Alison was kind of saying, that 5.45 billion seems like a really big number, like it's not being spent in the right way. So maybe we need to talk about the proportions rather than, more investment. Like we got the 3.5 billion or whatever million or whatever, 350 million from the previous New South Wales government that Rob knows isn't going into the right places. So maybe we need to really kind of use it to talk more like that, I think, is kind of what was going through my head in terms of an advocacy response. Yeah.
I agree, Emma, with what you've said around sharpening our analysis on this and how we advocate. But I think, if we were advocating for a genuinely balanced approach, a third, can you imagine what we could do with harm reduction? It is, as I said, it's the domain that has the strongest evidence base to show effectiveness, impact and cost effectiveness. Can you even, I'm sure it's hard for people to even imagine what it would be like to have a well-funded harm reduction sector. But, the sort of things we could do that we haven't done, and there's a lot we haven't done in Australia. Australia may have made some really important steps in harm reduction way back in the early days of the HIV epidemic, but we actually haven't progressed very far since, and particularly if you include in harm reduction, as I argued, decrim and law reform and safe supply and all of those kinds of strategies. There is so much more we could do. NSP in prisons just being another example, but there is so much more to do. And I just think, we really do need to sharpen our message, and we also need to bring the public on board, because we now know from the National Drug Strategy there is support out there for that. How are we harnessing that?
I would agree with everything that they've said. I think a simple message is really, really important. A third may not be quite that, but it is a simple message. I think the other thing that strikes me in this is we've all talked about the evidence. We've all talked about the fact that we know prevention harm reduction work. We've got really good cost studies that show there is a good return on investment, not just economically, but in terms of social costs and the lives of people in our communities. And I think we need to do a better job at communicating that evidence in a way that makes sense. And then the other thing, I think, when I was looking at the data and the fact that I think about prevention, and so many of the costs upstream would be avoided if we invested more in prevention. In harm reduction, we'd save so much, not in AOD treatment costs, but in healthcare costs more generally. But we've got this federated country, and we do not have a mechanism for our state and federal governments to talk to each other about this. And I think we have to have that re-established.
Thank you. Amanda in the front, and we'll take 2 questions in this one, just in the interest of time, and then...
Thank you. Amanda Roxburgh, Burnett Institute, fabulous work all. And I just wanted to pick up on what you said, Annie. I wonder if maybe, in the lead up to this fabulous drug summit that we're going to have in New South Wales, could we actually not imagine, but could we start doing some costings and say this is what would be possible if, and maybe it's not a third, but, try and do some costings and take that to the summit? I don't know, just a thought.
Thank you, Amanda. And we'll grab a second question just there.
Thank you, everyone. My question is about palatability, because I think the thing that's always missing from these conversations is politics. We've had escalating law and order kind of arguments in all of our elections. I mean, they work less effectively than they used to, but that doesn't stop politicians from reaching for that as a strategy. The other thing that occurs to me is that police are really good at putting budget cases forward. Like as Rob said, we can't even get the Commonwealth to make our treatment funding recurrent like we're going to solve the drug problem in a couple of years' time. We're very optimistic about it. Whereas the cops are always, like the AFP are out there now touting for extra money for vapes, for God's sake. Like they're not already at the border policing things coming in. It's going to cost an extra 180 million to get the job done. So I wonder what we can learn from our colleagues in law enforcement about being a little less kind of grateful for what we get and a little more bolshy about actually what we need to do.
Thank you. And that aligns with one of the questions online, which is about the effects for law enforcement. So I'll pass to the panel to respond. Who'd like to kick us off?
Yeah, maybe if we started, wearing guns and having big fancy uniforms and stuff, we'd be taken a bit more seriously with our budget asks. Not proposing that we wear guns. Yeah, I think it's a really good point. The politics of this are really, really difficult, and you're right. Like the law enforcement budget just keeps on going up, and those that are prosecuting that are very powerful. I mean, the police. They're not going to stop keeping on asking for those increasing budgets and doing it well. I do think we could do more to try to mirror and learn a bit from their experience. But the reality is, it's very, very difficult, to get the attention of government on these issues. And it's not that we're not trying incredibly hard. All the work that Rob does at Harm Reduction Australia, that Erin does at ADF, I mean, they are constantly trying to take this issue to government with these kind of evidence cases, and government does go to those kind of loud voices of police and fear about crime and law and order issues. So we do need, the Drug Summit is an opportunity to kind of try to change that conversation. And I mean, I don't, it's what I have. So in terms of what the potential is, in terms of the way we can change policy, I realise it's very imperfect. I also think, though, we need to not be surprised when we have shock jocks and small proportions of the population and the media kind of come out with that really negative law and order type commentary. And we need to start, in our conversations with politicians, really inoculating them to the fact that will always be there. And that's like the squeaky wheel. They've got to start thinking of that as like the squeaky wheel. Do they really want to be oiling the squeaky wheel, or do they actually want to be working on prevention and harm reduction? Because the squeaky wheel will always be there. And I think so part of those conversations is that to encourage them to stop feeding that beast and to actually start doing the things that are going to make a difference for the people they're meant to be representing.
I think that there's something about changing narratives as well, and I think we're well overdue to change the frankly tired old narratives around illicit drugs, but it is so urgent and so needed, and it's a job for every single one of us every day of the week, in every single conversation you ever have with anyone. If you don't believe in the sorts of policies and the politics and the shock jocks and all of the rest and everything that we're all taught to believe from the moment we're born, literally, it's a long road, and it's not going to change unless we commit to the long road of changing it. It's going to take a really long time. There's no miracles going to happen here, but it is about every small engagement that we all have with everyone in our families and everyone else, our neighbours. Don't just sit by silently and accept those tired old narratives, because that's what we need to change. And we also need to partner with those, in very smart ways. I think it's not that we're not doing this, but there are increasing numbers of ex-law enforcement people and others in the judiciary and criminal justice system who do support harm reduction and other approaches and decriminalisation. And I think we need to utilise those people better. We need to get on the fact that the public is changing its views ever so slightly on some of these things and capitalise on that. I think it is a long road narrative change that then underpins a policy shift, but you know, I don't think there's any sort of miracle answers here. Yeah.
We have run slightly over time. Erin and Rob, I'll give you a final quick comment.
I was just going to say that I think I look at that table. Law enforcement is one line in it. It's one voice calling for one thing, pretty much. There's 3 lines, 3 voices calling for 3 different things. And I think we can do better at coming together with a common call for action instead of pushing forward different policy options that compete for the same budget, and to actually ask for more pie rather than more of the pie. And I think as a sector we can do a lot to make change in that. That might mean the road is not so long, Annie.
I mean, yes, I agree with everything that's just been said, and I also think about what they're not hearing, because there was a drug and alcohol service planning model in New South Wales. They did a business and funding model to look at costs of services. It's about the implementation of those things, and I think sometimes government gets freaked out that they don't have a limitless budget, and I think we need to think long term, as Annie was saying. If there's a long-term strategy that incrementally we are going to get here, whether that involves targets, but I do think there's an opportunity with the current review of the National Drug Strategy, which apparently is now going to be a framework, not a strategy, that it can't just be peak bodies and other people having a voice. We all need to have a voice to talk about what we want from the next strategy/framework.
Wonderful. So we have run a little over time, but can everyone please join me in thanking our panel? Thank you also to our audience, in person and online. Apologies we couldn't get to more questions, but please continue the conversation over morning tea. The drug budget report is now live. There's a link in the executive summary that you're all given, and if you're online you can Google it and it'll pop right up. Thank you everyone. Enjoy morning tea.